Assalamualaikum warahmatullahi wabarakatuh. Greetings, professors, doctors, ladies and gentlemen. My name is Seruni Hanna, and I would like to present my paper with the title of Artificial Intelligence for Retinal Detachment Detection, a systematic review of current application. Retinal detachment is a vision-threatening condition with a relatively high annual incidence. Early diagnosis and treatment of RD are crucial for anatomical and functional outcomes. However, detecting RD in an early stage could be challenging, as it often is asymptomatic and progresses gradually from the peripheral retina. As a result, most patients seek medical attention when the RD has already reached a more advanced stage, resulting in poor outcomes. RD screening possesses challenges, especially in underserved regions with limited access to ophthalmologists and in large populations. In recent years, artificial intelligence using deep learning algorithms has made significant advancements enabling automated detection of retinal diseases using conventional fundus images. To overcome the limitation of conventional fundus imaging that can only provide a limited visualization of the peripheral retina, the ultra-wide-field fundus imaging system can be used for efficient RD screening. Combining the two may provide the potential to detect RD accurately. The purpose of this study is to evaluate the latest advancements in detecting retinal detachment using deep learning algorithm and ultra-wide-field fundus imaging. The review is conducted based on the PRISMA guidelines. Comprehensive literature search were done through 5 online databases. The literature search were based on the PICO as mentioned above. Search results from each database were imported to Ryan, where duplicate records were removed and studies were screened for eligibility criteria. The eligibility criteria of the study includes using artificial intelligence to detect retinal detachment, evaluating the accuracy of the model, comparing the index stats with ophthalmologist diagnosis as the reference standard, and diagnosis based on the retinal images captured by UWF fundus imaging. The search strategy initially retrieved 587 records, of which 410 articles were screened by each reviewer independently after duplicate removal. 8 full text articles were screened for eligibility, and a total of 5 articles were selected for final analysis. Quality assessment was done using QuADAS-2 tool for diagnosis accuracy by the 2 authors. Overall, the study showed low risk of bias in the 4 domains. Only one study has unclear risk of bias and applicability concern in the first and third domain, resulting from no definition or diagnostic criteria of retinal detachment features. The 4 studies included were conducted in China, while 1 was in Japan. The studies describe their study population, the demographic characteristic of their study population, which are age and gender. 3 studies define pragmatogenous retinal detachment as the type of RD feature assessed. All studies applied the state-of-the-art convolutional neural network or CNN architecture. 4 studies used a 2-stage detector, while 1 study used a single detector DL algorithm. The studies also reported the number of images used for training, validation, and test set. All 5 studies obtained their image datasets retrospectively from patients who had taken fundus photographs in their hospital. All studies reported that the DL algorithm for retinal detachment detection achieved high diagnosis accuracy measures, with the overall sensitivity, specificity, and accuracy ranged from 87.5% to 100%, and area under the receiving operating curve ranged from 0.98 to 1.0. The results are comparable to the reference standard of ophthalmologist diagnosis. There are 2 types of DL algorithms to detect RD that were used in the study, single-stage and 2-stage detectors. The difference between the methods are 1-stage detectors have high-speed object detection, while 2-stage detectors have high localization and recognition accuracy. Wang et al. Tested a single-stage detection algorithm named YOLOX. In the study, the YOLOX model showed comparable results of diagnostic accuracy to the other 4 studies that used 2-stage detection algorithm. Tang et al. Uses a multi-label classifier of 2-stage detector CNS of 3 2-stage detectors, with comparable results to the studies that use binary classifier. The studies reported the workflow of DL algorithm, with which the picture shows an example of the workflow by Weekly et al. In developing the use of the DL system in UWF imaging, image datasets that were obtained were labeled by ophthalmologists independently, and poor quality images were excluded. The qualified images were then randomized for training set, validation set, and test set with no overlapping images between the sets. Data augmentation was also done during training and validation to increase the diversity of datasets. Lee et al. Introduced a second model to identify macula on or macula of RD. The model will translate the finding into the optimal timing for RD surgery and the possible visual prognosis. The model will be useful for RD screening to determine the need of immediate treatment and improve prognosis. In 3 studies, deep learning was used to detect other peripheral retinal lesions associated with retinal detachment, such as retinal break and lattice degeneration. The DL algorithm also shows high diagnostic accuracy, which can also have an impact on the early detection of the risk of RD. The ultra-wide-field fundus imaging is preferable for RD detection as it provides visualization of a 200-degree angle retina in a single capture with no requirement of dark setting or papillary dilation. And because of the simpler procedure, it requires less skilled operators than fundus photographers. However, the significant downside of UWF imaging are high upfront expenses and the fact that the device cannot be easily transportable. To conclude, artificial intelligence using deep learning algorithm provided high diagnostic accuracy in retinal detachment detection using UWF. Further interrogation and improvement of artificial intelligence are expected to offer new possibilities in early diagnosis and treatment of retinal detachment. Thank you.